Hi, Susan here. Let's talk about Wegovy or semaglutide, which is a relatively new weight loss product that's widely talked about. It's very popular among those persons who want to lose weight and keep it off. But what I want to address is what is Wegovy or semaglutide? How safe is it to use? What happens if you stop using it? And what about its availability? I hear that it's really difficult to get now that a lot of people are on board with Wegovy. So semaglutide, or the brand name Wegovy, is approved now by the FDA for weight loss. It is a GLP-1 agonist which releases GLP-1, which is a naturally occurring hormone. This hormone works to increase insulin in the body and thus helps patients with diabetes control their blood sugar. But it also has an effect in the small intestine and in the brainstem, which affects how fast the food moves through the body and also an appetite, thus promoting sense of fullness and less appetite and greater weight loss. So semaglutide has been shown to be very effective for weight loss for persons with at least 30 BMI. And one study did follow patients for 52 weeks after they stopped using it, and they found that they did regain the weight. However, they did not go back to the beginning weight. They still had achieved a net 5% decrease in weight. Another interesting fact that was learned from this study was that the gains in improved LDL and HDL and triglycerides were maintained even 52 weeks after stopping the medication. So these researchers concluded that it seems that when appropriate, these patients should maintain or should continue to use semaglutide in order to maintain weight loss. So now let's talk about side effects and risk factors associated with semaglutide. One of the most common side effects with semaglutide is nausea, vomiting, and diarrhea, which can be reduced when the dose is increased slowly over time. If you do experience nausea, vomiting, and diarrhea, please be wary that you may become dehydrated, and make sure you stay hydrated and take your electrolytes. Risk factors associated with semaglutide include medullary thyroid cancer. So if you're currently experiencing this condition, have had it before, or have family history of medullary thyroid cancer, then you need not to take this drug. Another risk factor is associated with pancreas and the gallbladder. So routine monitoring of your gallbladder and pancreas is necessary when taking this medication. And third, not really associated with a GLP-1 agonist like semaglutide, but as a weight loss class of drugs, is the risk of depression and suicidal ideation. So be wary of that. If you've had history of depression or are battling depression right now, please be careful if you do decide to use semaglutide. Have a conversation with your doctor and stop using it if you do feel like it has made an impact on the way you feel. So now let's talk about getting semaglutide if you decide you want to give it a try. So you get a prescription and you go to the pharmacy. So what do you learn? You learn that 1, your insurance covers it, but only for a limited time period. Or 2, your insurance doesn't cover it. So what is your out-of-pocket payment? Well, according to GoodRx, a 1-month supply of semaglutide 2.4 milligrams can run from $1,300 to $1,500 a month. In order to meet the demand for the semaglutide, there are now compounding pharmacies that manufacture these for online weight loss programs. These weight loss programs involve telemed, where the doctor will meet with the client to evaluate whether they can qualify for semaglutide. And then if they do qualify, then they get a prescription for either the brand name Wegovy or for a compounded product manufactured by a compounding pharmacy. Now, who are these compounding pharmacies? They are regulated by the state boards of pharmacy. They make products that are prescribed by doctors when there aren't sufficient supplies available to meet the demands of the public, and also to meet the demands of the individual patient who may not be able to use the product that's manufactured by the drug company. For example, there are many people who can't swallow tablets or don't like the flavors of a certain syrup or have allergies to certain excipients in the products. So the doctor will ask the compounding pharmacist to make a special formula for them. So I hope you found this information useful. If you have any questions, please post them in the comments. And like always, please subscribe for more upcoming health information. Thank you so much.